10:30 on the nose. Shall we begin?
Yes, please.
Okay, good morning, everyone. Thank you for joining us for this very special announcement today. My name is Carly and I'll be your moderator. We also have Anthony as host, controlling the call this morning. I'd also like to welcome media friends for attending this announcement. We'll provide you with a virtual photo opportunity and a Q&A after the presentation. Now please welcome our lead on this ECHO announcement, MPP for Richmond Hill, Daisy Y, for her welcome remarks.
Thank you very much, Carly, for your kind introduction and for all of you attending and joining us today. I want to start by thanking the staff and the leadership, especially for LTAF, to be here at Mackenzie Health. I want to start by thanking the staff and the leadership here at Mackenzie Health in Richmond Hill and Vaughan for your incredible and ongoing efforts in the face of COVID-19 outbreak. These are the unprecedented time for all of us. But when the virus swept across the world, our doctors, nurses, PSWs, and healthcare workers are really showing the depth of their compassion. And I just want to say thank you for keeping us and protecting us safe. I want to extend my deepest appreciation of all the staff and physicians and nurses and volunteers for all your efforts. Thank you. As we continue our fight against COVID-19, it's been more important that our healthcare providers and frontline workers have the facilities they need to continue providing the care in a safe environment. Investments in infrastructure projects help hospitals making the necessary upgrades, repairs, and improvements to ensure that they can continue to deliver the accessible and high-quality care for the patients and families. Our government recently announced we are investing $175 million to address the critical updates, repairs, and maintenance in 129 hospitals across the province, including $50 million dedicated towards COVID-19 and other upgrade projects. Among other things, the funding will help to replace the upgrade roofs, the upgrade of the roof, the windows, security systems, and fire alarms. I will help to address emerging needs such as updating HVAC system, creating additional negative and pressure flow rooms, and enhancing infection prevention and control measures. These projects will help our ongoing response to COVID-19. So I'm pleased to announce today that Mackenzie Health will receive over $1.3 million to support the critical upgrades to the sprinkler system and the replacement of the air handling, the air conditioning units in the hospital. The health and well-being of Ontarians will always be our top priority, especially to continue to work together to defeat COVID-19. We will continue to invest in patients, hospitals, and our frontline healthcare workers to ensure Ontarians continue to receive the care and services that they need and they deserve. And thank you very much for our presentation so that he can really say something from his heart as well. Let's start our presentation. Thank you very much, LTAF. Thank you very much for Mackenzie Health for all you're doing. So we used to be holding the check in front of us and just saying all the appreciation and the gratitude that Mackenzie Health has been doing for our community, for York Region. But now we have the check on the screen and you will have that deposited right into the bank. So without further ado, can we invite LTAF to say something and just want us to see how we can make this good funding into great use. Thank you very much, Altaf.
So thank you so much, Daisy. And I would like to thank, obviously, Daisy Y as our MPP for Richmond Hill, Stephen Lecce, MPP for King Vaughan, Michael DeBolo, MPP for Vaughan Woodbridge, Michael Parsa, MPP for Aurora, Oak Ridges, Richmond Hill, and Gila Martow for MPP Thornhill. You know, when I talk to my colleague CEOs, they feel very envious and jealous that I actually have 5 MPPs who work tirelessly every single day advocating for healthcare in this community. Not just around HERF funding that we're talking about today, but your ongoing support for operating dollars, for advocacy around looking at other programmatic areas like mental health, and your just connection to me on a regular basis around what we can do to improve care. Your ability to connect to our frontline staff and engage them so that you can learn and appreciate more critically what some of their challenges are. So not just hearing from management, but also engaging physicians and nurses around what they're experiencing day in, day out. You are absolutely committed to being connected not just to the leadership, but to the frontline providers that make a difference every single day so that you can advocate more effectively around what the key priorities are for healthcare. I have to stress how incredibly effective our government has been around fighting COVID-19. The efforts of our premier every single day promoting the key public health measures of hand washing, wearing a mask, and most importantly, the physical distancing has enabled us to effectively battle this very challenging virus. And as much as the cases are rising in our community, we are still doing very, very, very well as a province, balancing the needs of healthcare and keeping our economy going. So again, I want to thank all of our MPPs and our premier for their incredible leadership in very, very challenging times. Unfortunately, you know, we were not able to do this announcement in person, but this was done very purposely working with Daisy's office to ensure that we can continue to keep everybody safe and ensure that we are leading by example by demonstrating the importance of physical distancing in this very challenging time. You know, I am so fortunate as a hospital CEO that we're talking about the Mackenzie Richmond Hill Hospital, but we're also celebrating the addition of a second hospital in this community, the Cordalucci Vaughan Hospital, that will double the access to healthcare for this growing and aging community. So we have the benefit of celebrating the benefit of 2 hospitals. And as many of you spoke, and actually I think last Friday you were all at the Cordalucci Vaughan Hospital celebrating the substantial completion of this amazing facility. So we're so fortunate that we are in this place of having 2 hospitals. Obviously, the Richmond Hill Hospital is a key player in the healthcare delivery to this community. We always need to ensure that we need to deliver safe, high-quality care both today and into the future. And the Health Infrastructure Renewal Fund is a key sort of facilitator of that. Upgrades to our sprinkler systems, to our air handling units and our air conditioning units. It's challenging in a hospital because we are always trying to advance our agenda by buying new equipment and new technology. And sometimes we forget the need to invest in the things that are behind the walls, that are not visible to the staff, that are actually foundational to continue to advance the healthcare agenda of delivering more advanced care. So these are the things that sometimes get forgotten, but they're fundamental to delivering advanced, safe care. So without these funds, we could not continue to advance the care agenda in this province. It is so vital. So I am again so thankful to have so powerful a group. I call it the A-team of MPPs that are always advocating on our behalf, that are ensuring that they're grounded in the needs of our constituents, and that they're always engaging both the leadership and the frontline staff to understand what the priorities are. So I thank you for your support. I thank you for the bright future we have in front of us as Mackenzie Health and the 2 hospitals that we will have in a matter of a few months. And again, thank you for your continued investment in healthcare.
So media that is present, I know Joseph is here, and we are going to open that up in the chat. Joseph, if you can write down your questions, who you're directing it to, that would be great, and I'll read that out for everyone. Do we have any other media on the line?
Unmute. Okay, can you hear me right now?
Yep.
Yeah, okay.
Yeah.
My question is that according to news, one hospital in York Region has to lay off medical staff due to funding shortage. And also there's a complaint about the possible medical negligence. My question is that—
Sorry, Joseph, if you could relate the question to this funding, that would be appreciated.
It's regarding, the funding is pretty clear. I don't have any question. My question is that how the government and the hospital can assure the smooth and reliable service from the hospital during this pandemic. Thank you.
May I invite our ministers, both ministers from Vaughan, both of them, to respond to his question then. Minister Lecce, do you have something that you can respond to him?
Oh, he's muted.
Okay, there we go. Well, what I can say is we announced a $27 billion 10-year infrastructure investment for healthcare delivery, which is significant to improve the quality of care and reduce the wait times that our government inherited 2 years ago that are just unacceptable for patients and families that just want to get care that they deserve. And so the basis for providing investment today is going to make a difference to make sure our hospitals, the infrastructure is modern and really is able to meet the needs, the growing demand and the demographic changes of the population, making sure that our seniors especially are cared for, but also our students, something that I have a particular interest in. And so that's why building a new hospital, the first one in over 20 years in our community, the heart of York Region, serving several municipalities and hundreds of thousands of families, I think is going to be a game changer when it comes to stepping up our quality of public health care in the province of Ontario. And I think that's also being supported by countless investments in our COVID-19 response, increasing testing, making today, officially as of today, there are dozens of pharmacies across Ontario providing asymptomatic testing. And obviously, new guidelines, new restrictions to help us reduce the spread so that our families and communities are safe. So there's a lot we are doing. And I think there's more to continue to do, especially in the context of COVID. And I'll turn it over to Minister Tabolo to build on that. I think you just have to unmute him, please. Yeah, I went through that too, Michael. I know the pain.
Yes.
Okay.
Okay.
Thank you.
Right. Thank you, Stephen. The whole, as was mentioned by Minister Lecce, our government approach is to ensure that we're able to deliver services effectively to all the people in the province and that we have a system that works for everyone. The investments that are being made to not only upgrade the existing hospitals, but also the new hospital is going to add capacity. One of the things that we're finding is that we need more healthcare workers, and there definitely is a need for more healthcare workers in the system. So I think the thing that we're doing and what we're trying to accomplish is to expand the availability of services on a quality basis to everyone in the province. And from my aspect, when it comes to dealing with mental health and addictions, it's also important that we work with the system that we're putting in place, the roadmap to mental wellness, and provide those services through different supports, whether it be doctors, whether it be nurse practitioners, master social workers. So we're expanding the base and trying to provide the best services to the different people, to people throughout the whole province, and build a connected system.
Thank you very much, ministers. Joseph, do you have any additional questions?
Okay, hi, can you hear me? Yeah, I think I really appreciate the funding announcement today, because I came to a garage of the one hospital. I see the rusting pipes and the paints coming off from the wall. Then I know that this hospital is old and need to refurbish. But on the other hand, I think I did attend the MPP last year's media conference in Mackenzie, Richmond Hill. It's also about the funding announcement of the renovations. And my question is that I think everything has a lifespan, right? So does need the hospital to request funding for maintenance, or the government itself will automatically assign certain fundings for the hospitals? So it's not an advocacy. You need advocate to get the funding, or you get the funding automatically? That's my questions.
Thank you very much, Joseph, for the question. And yes, first of all, the health and safety of all our people in Ontario is the most important thing for us. We make sure we put enough extra funding for COVID-19, and now we're putting another funding just to improve what is needed for each hospital. Yes, the Ministry of Health are evaluating the hospital, the requirements across the province, and then we are doing the announcement. And of course, each hospital will be sending us their plans and what they need, and we are evaluating that, what is required, and we also see what is required in the different communities as well. We would do our best to use the best we can with the taxpayers' money with what we can do, and safety and the health of Ontarians are the most important thing for us. I would like to invite my other colleague if they have anything else that they want to add. Please add to this. Thank you.
Sure, if I can just add in to build on what Daisy, you were saying. Every building has a capital budget in terms of the needs to maintain the property over the course of time. One of the things that has happened in the past is that there's been no investments in the infrastructure, and we've seen that not just in the hospital sector, but in the education sector. And we recognize this as being a huge issue that needed to be addressed if we wanted to keep our institutions, our assets viable for future use in generations. So there are monies that are set aside every year, and our government has actually extended and increased the amount of money being invested, given the fact that so little had been invested in the past. So you'll see that the work that's being done in the hospitals, the work that's being done in the other institutions, is all to improve the quality of the buildings and ensure that they're there for future generations as well.
Yeah, just to build on what Minister Tibolo said, just in the context of the allocation, about $125 million is formulaic, so it's built on a formula, Joseph, of where the funding goes based on some sort of preset criteria. And then the $50 million specific for the COVID fund, that COVID emergency fund, that's submission based. So you put in an application, and the Ministry of Health would review it. So there's a base component, the 125 million, and there's a formula. Then there's a application base for the rest. But suffice to say that Mackenzie is getting significant funds in addition to well over $1 billion of provincial funding to build a new hospital as well.
Mm-hmm.
Sorry, I can't find the mouse. All right, so my last word for today is that there are more politicians getting infected by the virus. So I hope you MPPs and all your staff taking care of yourself. Make sure you're okay, safe and healthy, because we don't want the Parliament or Queen's Park be shut down by the virus. Thank you.
Amen. It's the shortest answer I've ever given, Joseph, but I will agree and leave it at that. We all have a responsibility to do our part, so I agree. Thank you.
Thank you, everybody.